that are leaders within the profession. We are going to start off the webinar by asking our panelists to introduce themselves. So, Dr. Monaco, why don't we start with you?
Hello, good evening. My name is Jennifer Monaco, and I grew up in New York, and I went to New York College of Podiatric Medicine after undergrad in Washington, D.C. I did my residency all the way out in beautiful San Diego, California, and I crossed the country to Baltimore for a fellowship, went over the Atlantic to another mini fellowship in Switzerland, and then went all the way back to California for a decade. And then I was in private practice in Connecticut, and now I'm settled in Georgia. In my own practice, I work for myself, doing diabetic reconstruction, pediatric cases, and everything in between.
You also served as faculty at one of our sister schools.
I did. I worked for 3 years at Western University of Health Sciences, and then I've done about 10 medical mission trips, mostly to Kathmandu, Nepal. I led 8 of them, and hopefully get back to it soon. But starting your own practice, it's a little harder to get out for international surgeries. So hopefully that's on for next year.
Thank you, Dr. Monaco. Dr. Patel.
Hey, Lisa. Hi, guys. I am a born and raised New Yorker, like Jen. I did stay in this area. I did my residency after NYCPM at Atlantic Health System in New Jersey, and then eventually ended up just joining a practice and now owning that same practice where I'm the managing partner of a 5-doctor group. I am in private practice, but also have quite a few extracurricular things that I do in industry, but also in some leadership positions within our field. And, it's been a quick 14 years since this started. So.
Wow. Thank you. Dr. Pravetti.
Thanks, Lisa. Hi, everyone. My name is Jackie Pravetti. I am NYCPM class of 2013. Prior to that, I grew up on Long Island. I went to undergrad at Fordham University in the Bronx. I ran track and field there, which is how I got into podiatry. Essentially, now I'm in private practice. We have 6 offices and 9 doctors. I'm a partner at that practice. Additionally, I serve educational roles in a residency. I trained at New York Presbyterian Queens in Flushing, so I'm currently faculty there. I also work with the Northwell programs on Long Island, and I'm also politically involved at the state level for the New York State Podiatric Medical Association, which represents podiatry as a whole, practicing in New York State currently. So that's pretty much it.
Thank you. Dr. Godoy.
Hi, everyone. My name's Heidi Godoy. So I'm the class of 2015. That's just a little typo there. So I graduated residency in 2018. I did that out in Scranton, Pennsylvania. I am from New Jersey, so I came back to New Jersey after residency, and I did a fellowship, a 1-year fellowship in pediatric foot and ankle pathology, deformity in North Jersey. And then after that, I joined the family practice. So my mom and my sister are both podiatrists, and we have a practice in Northern New Jersey, Godoy Foot and Ankle Center. And my mom just retired, so now it's just me and my sister. I treat a lot of children. I did again, like I said, I did a peds fellowship. So pediatrics is my specialty. It's what I love to do. It's been rewarding. So I'm, I guess, the youngest one here. So I'm only a few years out. So all these other wonderful women will have a bit more experience than I will. But regardless, happy to answer any questions.
Great. And actually, that's what I'm going to do. So tonight, what I will do is I will throw out some questions to our panelists, but we're hoping that this webinar will be more interactive. So whether in the Q&A box or the chat, feel free to write out any questions you might have for any of our doctors here. That said, we have with us some of our current students. I see some familiar names, but many prospective students. So maybe we can have you tell us how you all got first started in podiatry, meaning how did you get interested in podiatry and what led you to move forward with your profession. So Dr. Monaco?
Okay. So the story's famous. Lisa's the one who got me to go to NYCPM. She's an excellent recruiter. So I was a co-biology club president at Catholic University, and I literally had to go to this meeting, even though it was like 3 days before senior comprehensive exam, because I was co-biology president, biology club president. And there was a gentleman, a podiatrist, Dr. Glickman, who is actually big in our profession. He came to speak to us for pre-health sciences stuff, and he worked with the Washington Redskins. So my work study job was actually a student athletic trainer. So for 4 years, I did all the PT and first aid for men's lacrosse mostly, but I worked with football, basketball, and everything in between. So I kind of didn't mind feet. I like to say I didn't like feet. I just didn't mind them because I worked with them a lot. And then I got more interested in that from that perspective because he worked with the Washington Redskins, and I ended up working back home on Long Island for my aunt's podiatrist for 9 months before I met Miss, Dean Lee, and she roped me into coming to NYCPM, and there you go. And that's the story.
I wrote you? Sorry, we'll talk about that later.
Totally did.
Well, you're happy now. Dr.
I am.
Patel. Dr. Patel.
I mean, I feel like I'm going to say the same story. Lisa forced me to come
Oh
to
my gosh.
NYCPM. I'm just kidding. It's a joke. So much like you guys who are in the audience, I went to an open house at the New York College and met quite a few students and doctors who were presenting about podiatry as a whole. I was at undergrad at NYU and I had been to a podiatrist myself, but it never occurred to me that that was something that maybe I could potentially get into until I went to the school and just learned a little bit more about the profession. When I started considering applying, I shadowed a podiatrist on Long Island. And you know what? The one thing I would say is that he was just generally a very happy, contented person because he was able to bring some pain relief, some creative solutions to fix problems of people's feet. And then, he seemed to have a great quality of life. And that's kind of what I gravitated towards. And then I met Lisa and she said if I didn't come to New York, she would, find somebody to hurt me. So I came. I
That
love
might
you,
be a little-
Lisa.
I love you too.
I love you.
Dr. Pravetti?
So as I said, I actually went to Fordham University in the Bronx and I ran track there, and that definitely kind of dove me into something medical. And my pre-health advisor at the time at Fordham actually recommended podiatry. And then upon further investigation and looking into the school, I realized what a great fit it was. My initial instinct and my initial interest, I guess, in the profession was with athletes, but after learning more about what podiatry is, I realized how broad it was and how diverse it was and how much of a difference you really can make, not only in student athletes' lives, but in everyone's life, and anyone that's really in need. So that's really how I got into it. And in terms of choosing NYCPM, I mean, that was a no-brainer for me, close to home and a great clinical experience. So that's kind of my story.
Great, thank you. Dr. Godoy?
So I don't really have a fun story. My mom and my sister were podiatrists, so it was kind of the next steps for me. But similar to Dr. Patel, I shadowed my sister, and she loves this profession, and I knew it, and I felt it early on when I was in high school. She's 11 years older than me, so I knew that that was something that I felt like I could also really enjoy. And after shadowing her, I was like, let's do it. And New York was the only option. So just strictly because my mom and my sister both went to the New York school. So I didn't apply anywhere else. And it was a fantastic decision, by the way.
Great. So I know some of you are involved and mentioned a little bit day-to-day basis in your practice, but can you also share with us maybe some of the activities or involvement you have outside of just the practice of medicine? Anyone want to take this? Okay, you know what, Dr. Patel?
I had no doubt in my mind you were going to call on me. I missed a little bit of your question because you were breaking up, but I'm assuming you said besides just private practice, what else do we kind of do on our day-to-day?
Exactly.
Okay, so you know, early on in my career, I knew I wanted to be involved in leadership. It was always something I was passionate about. So I joined the New Jersey Podiatry Medical Society and escalated up the ranks over the course of years and became one of the youngest and only South Asian president of the New Jersey Podiatry Medical Society, which was great. It was a great learning experience. I spent a lot of time on the board at board meetings trying to just learn and understand what what we could do to make our profession better. And then more recently, I've been working with consulting as a speaker for industry. And one of the things I'm super passionate about is working with Stryker, the orthopedic company. And most of my work there, besides being surgical and talking about techniques, is really to advance women in medicine and women in podiatry, and provide sort of good techniques to advocate for yourself as a female in medicine. I do work with a couple of other companies, but that's really my other thing, besides the fact that I have 2 young boys who are 6 and 9 and keep me super busy in life.
Thank you. Anyone else? Okay. So why don't we talk about what is your, maybe like a daily snapshot, or what is it like to practice in your private practices or whichever settings that you are in? So why don't anyone feel free to jump in?
Yeah, sure. I'll go. I am, I guess you could call me a business owner. It's still weird saying that. So my mom retired and now it's me and my sister. My sister's a teacher at the New York school, so she's there part-time and then she's in our office the rest of the week. So I'm the one that's there full-time. So in addition to seeing patients, we don't have an office manager, so I do a lot of the business portion of running a business in addition to treating patients. So my day-to-day is seeing patients and then blocking off some times or maybe even like half a day a week to do administrative stuff. I mean, if that's something that you're thinking about doing, opening your own practice or something like that, hopefully you'll be smarter than me and have an office manager or someone to help you out with that in the beginning. We're working on that right now, but I take a lot of that work home. Unfortunately, I don't have kids. I am married, but I right now have the time to do a lot of the other things that go hand in hand with running a business. And then I'm also in the wound care center at a hospital by me 1 day a week, and I do surgery 1 day a week. I would say my seeing patients is about 50% of what I do. And then surgery is about 25%. And then all the other stuff with running a business is about 25%. So that's kind of my day to day.
Dr. Privetti?
Yeah, sure. So very similar to what Dr. Godoy said. So I'm a part owner at a practice with several offices. So some of my work is administrative, whether it be kind of any sort of administrative work for the many doctors we employ, or just some more of the billing aspect of it. Additionally, seeing patients, definitely part of my daily life. I have office hours, sometimes 5 days a week, with a surgery day every other week. There are weeks that are more busy than others. So sometimes it'll be a day where it's office surgery or surgery office, or just surgery. And then in addition to that, similar to Dr. Patel, I'm also involved in more of the advocacy portion of the profession. So some of my time also, aside from practice management and patient care, is in additional to that, more of kind of interacting with colleagues on the board for New York State, and more of that role. And lastly, something that I've become more involved in now, which also is involved in my day-to-day, is residency education. So really handling some of the academic affairs for some of the programs I work with is part of my weekly routine. And I think I hope to become more involved in that and stay more involved in that as well. Just through CPME and other efforts that way, involved in residency education too.
Great. Thank you. Dr. Patel?
My day-to-day, Sorry, is it my day-to-day? You want to know about?
Yeah, and like what your practice is like.
So I'm in the office 4 days a week and I operate on Fridays. Is there an echo?
There,
I'm sorry. Okay, just give me 1 second. Go to the next person. I'll figure out what's going on my computer. Hold on.
okay, Dr. Monica, we'll come back to you, Dr. Patel.
Okay. All right. So, I will say this. I was very used to working for other people. Like Lisa had said, I was a academic before and I worked at Western U. I worked on my own for multiple people. I was at Kaiser when I was in San Diego. And I worked for 5 years in an orthopedic group doing the foot and ankle surgery. And then I realized I didn't want to work for anybody else anymore. Well, first I met my husband, then I realized I didn't want to work for anybody else anymore. And I'm very, very lucky and blessed that my husband is a finance guy, well, he's a retired Army Ranger who has time to be my office manager. So we moved down south where there's a huge need for podiatric foot care. From the kiddos for sure, but we have a very large, we're in the diabetes kidney belt of America, and there has been the most complicated diabetic patients I've ever seen in my 16, 17 years has been since I moved to Georgia in a year. And I opened my practice cold, with nothing, with nobody, with, liquidating my 401k. And I'm in a year, I'm seeing an average of 400 patients a month, and it can be anything. So I call it, well, it was 3 local hospitals, now 2. Today, for example, is my surgery day, and I did the first frail technique. So this is a complicated Charcot reconstruction case, but I did the first one in Columbus using this specific technique with a specific orthofix IM nail and frame. So that was pretty awesome. Nice 5-hour case this morning. Definitely stabilizing this lady so that she doesn't get a below the knee amputation, because from our perspective, when I went to school way back in like 2 generations ago, I feel like it probably was, or 1 generation ago, the average diabetic, or the average number of diabetics in America, which we were quoted, was 17 million. It's approaching 50 to 100 million in the next 10 years. So this problem's getting worse, and I'm just grateful to be here. If there's anyone who wants to come visit me in Georgia and see what it's like, y'all can come work for me. Just saying, I'm busy.
You're
So
trying to
it's great.
recruit. Thank you, Dr. Monica. Dr. Patel.
I'm back. Sorry, I had some tech issues there. So that's fantastic, Jen, that you're seeing that many patients. Such a need down there. So I actually see probably around the same amount that Jen is seeing, but my practice tends to be a little bit more elective surgical, not the diabetic patient, and that's for good reason. I actually stopped taking call at hospitals once I took on the managerial role for as being the partner here, because it was just too much. My work life would not be where it is right now. I wouldn't be able to see my kids. I wouldn't be able to go to baseball games and all the other things I wanted to do. With that being said, the only way I can do that is I have a great team of other doctors here, our associates here, who love to take call and love to be in the hospital. And they're sort of in the time of their career where they can do that. So I do a lot of elective, ankle surgeries, bunion surgeries, fusion surgeries, kind of flat foot reconstructive type stuff. And I'm blessed that I'm able to just pick and choose what types of cases I want to do. On my day-to-day, I can see any number of patients, and I say, like, today's Thursday is a busy day, probably about 50 to 55, sometimes up to 70 patients in a day. And then other days it's a lot less. I do travel quite a bit with the consulting jobs that I do have. But that's what partners are for, and that's what associates are for. And I found it to be super, super rewarding to keep my schedule this way.
Thank you, Dr. Patel. I'm actually going to take a question from one of our attendees. What is the work-life balance for women in podiatry? Especially when it comes to starting a family, but I think one of the positive aspects of podiatric medicine is that possibly more work-life balance if you choose to. So maybe Dr. Patel, since you're the mom here.
Yeah. So you know what? I always hate calling it work-life balance because there's never a balance. I like to kind of refer to it more of a work-life integration. Because as Heidi and Jen, anyone who's like in the trenches of owning a practice, the work doesn't end. You don't go home and stop, thinking about what's going on at the office, right? You're kind of always on. Similarly, when I'm in the office, I don't stop thinking about my kids, right? Obviously, they're top priority. So this integration in any type of medicine is a tough one, right? Thankfully, I have a partner who's actually a partner. My husband is very much involved in our kids' lives and is integral to what we do. I think part of that question is about, family planning and when to think about children. We've had so many residents, female residents, who've had children during pregnancy. It's not something that, people shun away from. 15 years ago, when I was a resident, maybe that wasn't the case, and there was more of a stigma put on that. But knowing that, you're able to put in the work to get the training you need to do and have this type of practice that you want, I think it's always good to think about what's important to you and when to think about starting a family with whatever situation that you're in. I think as long as you're getting the training you need in order to get the practice you want, you will be totally fine.
And maybe everyone here can talk more about how do you balance your career with your personal life, with your other passions outside of medicine?
Yeah, I'll go. So I think a lot has changed in medicine, not just in podiatry, but in residency and all these rules that were there, even when I was a resident. And yeah, I had a co-resident that had a baby and came back the next day, and she was working the next day. And I don't know that that would happen anymore. I guess it depends on the residency, but what someone told me was, you can plan all you want and decide, oh, I'm going to have a kid after residency or during residency. And sometimes things just don't go to plan. So you just make the best of it. Being a business owner, I guess maybe you would have a little bit more leeway. And if you work for someone else, then you have certain hours or they expect you to be at certain places at certain times. So and in any part of medicine, you can decide exactly where you want to work. Or you can try and apply to places where you would rather have more autonomy versus being stuck in a 9 to 5 schedule. So there's a lot of options. I think that being a female in medicine in general can sometimes be a little challenging, but I think that you can make the best of it. And there's, I don't know. I mean, so I don't have kids, but I don't have kids not because I didn't, because I've been waiting. It was just my time in my life and that I just got married last year. So we're going to plan to have kids at some point. But that was just me. And I have a lot of co-residents or, colleagues that have kids that are, 10. So, so I think that it's not something to be scared of or to shy away from. You'll make it work regardless of where you do your residency, where you practice, whether it's on the East Coast, West Coast, etc.
Anyone else about work-life balance?
I'll talk about it because I did a lot of speaking on, I would call it physician moral injury versus burnout. I don't like burnout. It's just this thing that people talk about. It's all over the news. And the biggest thing, I think, the biggest take home, and I will full disclosure, I was very, very sick 3 years ago. So sick that I was out of work for 6 weeks, and just it was an interesting time in my life. But the reality when something like that happens to you is that there are places and spaces that you are valuable to, right? And the people that matter the most are your inner circle and your family. So you build your life around the people that you matter to, that if you're gone the next day, they will be upset. Our patients, for all of the love that I get from my patients, you'll have patients that don't remember that I did a surgery on them 10 years ago. So they're not your core. You are your core. Your family is your core. And you build your life around that core, which means, like, for us, that's why I got into private practice, but we have family time, which is the week between Christmas and New Year's. Now, business wise, everybody wants to have surgery the week between Christmas and New Year's. And I've trained my patients so far, and they listen, that if they want to get their stuff done, we are closed from December 24th until January 3rd. So they know that they have to book their surgeries before or after, but not there. And my office staff has family time. Nobody's in the office. It's closed. So that's what we value. as a couple, as business owners. And so we build that. The other thing I think everybody needs to understand is that no is a complete sentence. You can say no, like Krupa, she's not taking call anymore, which is valuable for work-life integration and sanity at some hospitals. So you need to be able to say no and be empowered to say no. That's it. Full stop. No, not doing it. And do not work for free. And you'll be happy.
Preach. Sorry, Jen.
If I could add, honestly, that was very well said, Jen. So to combine a lot of things that everybody just said, I go through this in my head over and over and over again. I don't have children. I pretty much, and I choose to do this. Like my life basically, I mean, my life is a lot of my job, and it's something I'm passionate about and something I truly, truly love. And I know right now in my life, that's the time to do this. I do want children, and I know I want children. But saying no is something I'm not good at. And I think that's something that takes skill sometimes for some of us very motivated women. And I think that's something that you kind of have to grow into, especially when you come out and you're ready to work and you're ready to make the most of it. And I'm still learning how to do that. So I think that's such an important point. And I think secondarily, like medicine in general is changing to, I personally think, to allow women to kind of have that flexibility now. And I think you kind of have to make your own decisions and do your own research as to when the right time is for you. And lastly, and really most importantly, I don't think there's ever a good time to plan. I've seen women in my own circle, join a private practice, have a baby, bounce right back. I've seen women wait and, they're established practicing doctors and they take time off and they come back and it's like they never left just because they have such a following. And I think that's feasible for anyone whenever they feel like the time is right.
Thank you, Dr. Pavetti. Another question that we have is sort of similar to the question that we usually throw out to our panelists. What do you enjoy the most about your practice, as well as what are some of the most common procedures within your practice? And from there, what's your favorite? Hello, anyone?
Who wants to go?
Dr. Monaco?
Okay, fine. What was the part of the question?
Uh-oh. I think the connection.
I'm trying. The first part of the question. Yeah.
Dr. Monaco, right now we don't have good connection with you.
Just go next person.
Yes, Dr. Patel?
Yes. First part of the question was, what do you enjoy most about your practice? So I love the variety, meaning I can have a patient who's like 3 weeks old, and then the following patient is 103 years old. So I personally love to connect and talk to my patients, sort of not just about their foot. I mean, our patients come in here and they get comfortable and they tell us about their entire lives. And we get pretty intertwined with what's going on with the rest of, their health conditions and who they're seeing. And, so our patients tend to connect with us more because they spend just a little bit more time in the room with us. So that's probably my biggest thing. I love to talk and I love to hear stories and I love to learn from patients, My favorite procedure right now is the minimally invasive bunion surgery that I am obsessed with. That's about it. I do it all the time and I love it.
Thank you, Dr. Patel. Dr. Pavetti?
Yeah, actually, variety is definitely a factor. I like anything elective in terms of surgery. I've definitely swayed toward the minimally invasive bunion craze, which I also love. And I did start to really enjoy more of the like challenging recon cases, which can be quite complicated, but the challenge of it is something that I actually like doing as well. And similar to a lot of the women that already spoke, there's no day that's the same. There's every day is different. The people you interact with are different. Their experiences are different. And that's really kind of the day to day that I enjoy doing.
Dr. Godoy?
So I'm sure everyone has gone to a doctor before. and you walk out of there and you're like, what the heck was that? Like, they don't really talk to you. They don't really, there's no connection, and they're just whatever, giving you whatever medicine you need. And every day I have patients say how grateful they are that I listened, I guess. And across the board, I don't think it's a me thing. I think it's a podiatrist thing, maybe a female podiatrist thing, but uh, that is something that it's always very humbling. I had a patient today in the hospital who unfortunately is 94 and is in hospice, and he's been my patient for a long time. Anyway, his daughter, very emotional today, but long story short, she said, "You've been our guardian angel this whole time." And so she was like, "Just tuck your wings in, and I'll see you tomorrow." And it's so nice, and you hear that all the time, whether it's a wound patient or a post-op patient for an elective surgery, or a kid with flat feet, or someone with arthritis. Like it's a very rewarding field in that regard, because you're helping people, and people are grateful that you're putting them out of pain. I guess my favorite procedure is an MIS bunion. I learned about it in residency. I like to say that I got my director doing them more when I was in residency, and then my fellowship director also. I was like, let's do it. So that is, and I think it's just all the craze right now. Everyone's been doing it the last few years, so it's fun. It's a fun procedure.
Thank you.
Okay, I think I'm back. Can you hear me?
Yes,
Yeah.
we can hear.
Okay, perfect. All right, so second question first. I'm fine with MIS bunions, but my favorite, and the one that I always challenge my residents to do, were soft tissue masses and then peripheral nerve surgery. So the soft tissue mass, I'd buy my resident a sandwich at the cafeteria if they were able to get the soft tissue mass out complete, especially a cyst, without popping it. So I think those really fine motor dissection, I absolutely love. If I could do ganglion cysts every day, I would, just from a kind of hands-on experience. And then the peripheral nerve I've been getting into, and I've had fantastic success with taking people out of chronic pain. And then the first part, I think, like everybody else, to reflect with this is, for some reason, for whatever reason, I think it's like we're at the other end of the body. These patients talk to us and like tell us our whole life story. So I take that as a challenge to get them healthier, right? So they're like, nobody ever tells me like to eat more meat or eat, steak and eggs and get my protein up. I was like, yeah, well, that, new doctor in town. And so I focus that extra time that I have with them on trying to affect change from kind of diet, nutrition, because of all my diabetic patients, but really in general, just to kind of get people on the wellness track early on. So that's kind of my favorite part, guiding them a little bit more and being their little health coach along the way, besides their doctor.
Thank you. Do you feel that there's ample representation of women in this profession? And are there any challenging factors because of your gender?
Can you hear me again? I'll go first because I'm a different generation. I mean, Krupa and I are probably around the same. I will tell you this, and I don't know how it's going to sound, but I grew up watching Quincy MD and the Cosby Show and all these things that I don't think that there was ever a female doctor, but I just wanted to be one, and so I made it happen. So I do think representation matters, but I don't want it to be limiting. So just because you don't see somebody who looks like you doing it does not mean you cannot do it. In fact, I would say it's a reason to go full force ahead and just make your own way. But there's a lot more. I think Lisa could speak to it. My class was probably 50% female class in 2007, and I feel like it's been at least that, if not more. So I think more. I see women all the time. I love it. I think most of the family practice docs I work with are women, so that's just my little pocket.
Well, have any of you faced any additional challenges because you are women within the profession or within medicine?
Yes, I mean, I'd be lying if I said we didn't. Jen and I are of the same generation, so it's a long time ago, but it still happens, almost on a daily basis. I'll still have a patient come in and, talk about how young I look, or that, come in and say, "Oh, I thought you were a man. I thought you were going to be a man." And I say, yeah, but not on Thursdays, you know, I mean, at the end of the day, I think Jen is 100% right that I've actually used the fact that I'm one of one because I'm usually one of one in a room where no one looks like me, no one sounds like me. I'm the only female, I'm the only person of color, I'm the only South Asian in the room as an advantage to really bring my thoughts and my experiences to forefront, right? So I'd love to say that, you know, I'm treated exactly the same way as my male colleagues, but I'm not. And I'm okay with it because, you know, I have enough fruition to know that I think being a female in healthcare is an advantage. I think even every study you can read about outcomes about female surgeons, they're better than male surgeons. And a lot of that is sort of the attention to detail and the care that we take of our particular patient. Like Jen said, it's a holistic, you know, look at your patient rather than just a very narrow focus just on a foot. Not saying that only men do that, but with that being said, yeah, there have been challenges. You know, I came out of residency in an era when it was okay for, you know, a potential employee to say, I'd hire you in a heartbeat if you were sterile, right? And that's an actual conversation I had. Yeah, I know. I see your head turn, Lisa. And you know, yeah, there's some things that happen with that, right? I still see residents who get contracts that don't have maternity leave in them, right? And these are all real things, and that we still struggle. 2024, it's still a thing because some of those historical perspectives, those folks are still here practicing, right? And it's hard to really change those ideas and thought processes unless you stand up and say that this isn't going to happen and we're not going to do that. You know, as the managing partner here, was, you know, our partners are very, very cognizant of what we offer to our female associates, right? Paid maternity, well, maternity leave, sort of as much as you want. Come back when you're ready to come back and hit the ground running. And it's a non-issue, but I still see it around the country. I talk about this to residents in mentorship programs that it's okay to advocate for what you want, just because, you know, it doesn't matter that you don't look like everybody else in the room.
Anyone else have anything to add? Okay.
I'll just quickly say, things are changing, but just yesterday I was in the OR and a rep walked in, and he wasn't my rep. He was bringing antibiotic beads, which candidly, I don't know why he was there, but he looked at the male resident and was talking to him versus talking to me, just because he thought that he was the physician. So I was like, "Hi, I'm Dr. Godoy." And then I just turned back to the table. And that's going to happen. That's going to happen for it's going to happen to you all the time, honestly. But I think all the women here are, most women in the field are very strong and they will defend them. You have to, and you have to speak up. And if you don't, then things will, you know, you let things slide over, and you don't want that to continue to happen. So I wouldn't say that I really let it get to me, but I do make it a point to make them aware of what they're doing. Yeah, that's it.
Thank you. And that's why it's so important to get involved with leadership within the profession as well. And just to go back on, I know Dr. Pravetti said her class, or Jen, was 2007 was 50% female.
I think so. I mean, it was definitely one of the more diverse classes anyway. So, I mean, we had people from everywhere, and it had to have been close to it, if not over.
Because right now, actually for us, I thought it's actually changing where it was still majority male, but now for our student body, because I just did a report, 60% of our student population is female.
Cool.
So, interesting fact. So I'm going to take a question from, I believe this is one of our current students. What do you suggest a Korean, sorry, it's been a long day. What do you suggest a current podiatry student can do to work towards learning about starting a practice or joining a private practice? Or is this something we're exposed to during residency?
I would, so I don't know, you know, I would join if it's still there, like the practice management club, if it's there. If not, just get online and join the, you know, podiatric podiatrist, you know, practice management thing. Also look at dental programs, but the reality is you have to figure out what you want out of life, and then you're going to build your business around how you want your life. So your business is going to support your lifestyle, not the other way around. Once you get to it, you have to do residency, all that stuff. One of my mentors who's only out 5 years, but is like killing it. He's fantastic. And he said what he did was he looked at the most successful attending that he had in residency. He goes, that's who I want to be. And that's who he shadowed. He befriended him. He said, how do you bill? How do you do this? So I think you kind of go out and craft your life in your head and then make it a reality. And that's just finding the most successful people that are ethical, caveat ethical. And then, learn from them and read as many books as you can. Dr. Wish's book is awesome. Podiatry practice success manual, whatever, but read, absorb, and then just keep asking, hey, how do you bill for this? How do you do this? Just because you're a student doesn't mean you can't get that knowledge now. In fact, get it now, it's easier.
Anyone else?
Yeah, I mean, I think I agree with Jen for sure. I think at the student level, it's definitely something you're gonna be more exposed to during residency. I don't think, you have to worry about it too much right now. I think it's something that sort of as you get into your residency programs and process and you're kind of moving to that phase of your career, you'll figure out sort of who's in private practice, who's, working at a hospital setting, who's at an ortho group, and you'll make those connections where you can kind of see, which type of system do you like the best, right? What works for you? And then everything that Jen was saying about thinking about what you envision for your life, you can kind of pair that with the exposure you get during residency. And I will tell you that in many residencies, it's a very self-directed thing. It's not that people aren't going to set this up for you. You're going to have to seek out the attendings you work with that you want to see what they're doing on a daily basis and just ask, right? If you don't ask, the answer is no. But I guarantee you, if you ask, your attending will allow you to come to their clinics or offices or hospital settings, wherever they are, and just get a data, an idea of what day-to-day is.
Dr. Pravetti, were you going to say something?
Yeah, actually similar to what Dr. Patel just said. So, I mean, I am thinking back to my residency. I mean, I didn't even know really until I started talking to people I trusted, very similar to what everyone's saying. And there's so many options. I mean, yes, there's private practice. That's a big facet of it. But I mean, now looking into other options and seeing what's out there, I mean, I may have considered something else, or you realize that, hey, I thought this, but maybe this. And it's really just about talking to people and kind of figuring out their experience. I mean, it's not just so cut and dry, like I have to do this or this. There's a lot more that you can really do and have some flexibility within the profession, the more people that you end up talking to. So I think it's a tough thing to really kind of gauge until you find this network of people that you learn from and that have taught you, and you kind of figure out what kind of lifestyle you want. Private practice is, there's a lot that's on your shoulders, as all of these women can attest to, and it's very rewarding, and it's an amazing experience, but you just have to kind of know you want it, and that's not an overnight decision, and that's not something that you're going to know like right off the bat. But it's definitely involving a network of people that you trust and that you can learn from and gain knowledge from. That's important.
It's interesting. I just realized we have a question from one of our guests. Should they get a business degree? And I can see why they asked that, because it just so happens that all our panelists are owners of their own practices. But I mean, you all can agree with me or not, or let me know if I'm not right in this. But right now, I think podiatrists have an opportunity to work in many different settings, even outside of private practice, where they can work within a healthcare network or a hospital. And as like Dr. Monaco worked for an ortho group in Connecticut for a while, we have faculty that are not necessarily involved with private practice, but their clinical is all via the school as a professor. So the starting your own practice is not the only option for someone going into the field of podiatric medicine. Am I right?
You're right. I would say no on the business degree. I think there are just so many opportunities, even even if you want to open a private practice, this is going to be one of those things you learn as you go, and all the knowledge you gain as you go through, figuring out how to get credentialed, how to do, how to open up your office, what do you need? That's what your network is going to be for. I don't think an MBA is going to change the way you create that system for yourself.
No, I said you can come work for me. I'll set you guys up. It's fine.
Jen is just recruiting. She's recruiting hard right now.
Look, I'm telling you. So I will tell you guys this, because everybody's in their own space. But I did the work. I kind of probably have done every kind of job except, well, because I worked at Kaiser, which is a multi-specialty group, right, in HMO. And then I was at the university as an academician and doing all that. And then I worked in an ortho group. And I realized I didn't like working for anyone else. So I became private practice owner in my 40s, right? Like 41 or 42. And so it's a very different mindset now. And I own everything, all of my stress. I'm actually happy with it because I know the buck stops with me and I'm the only one there. But podiatry has so much flexibility. You can join the military. And I will tell you, if I was where I am now health-wise, then I would have signed up for Navy or the Air Force or the Army. And I'm going to pitch that because they'll pay for your school, and then you will get the most amazing surgical training with crazy stuff at Walter Reed and all these bases, and you're treating a lot of elective stuff, and you do 20 years, you get out, and then you're in private practice and you kill it. So that's my little pitch for, go Army, because I think that it's an underutilized tool. And I do think that a lot of people get out, and I was a teacher, I was a university professor. There's a lot of burden with student loans, and there's a way to get off of it. And I think it's really one of those things that I would for sure look, if you were of that kind of mindset, it's not a bad option. Talk to the medical recruiter and get them to pay for your college, get them to pay for med school.
If not, graduate, finish your residency, move to Georgia, and Dr. Monica will give you a job.
Yes, 1000%. If you're qualified, come down and see me.
So I'm actually cognizant of the time, and knowing that we have many prospective students joining us today. Do you have advice for a student that is considering this profession, what they can do to explore, as well as for a student that might be starting their education and training in podiatric medicine? Dr. Godoy, should we start with you?
Yeah. So if you're thinking about going into podiatry, I would shadow a podiatrist, and not just one day. I would probably spend at least like 2 weeks. It doesn't have to be every day for 2 weeks, but a few days in the office. And if they go to surgery, maybe see if you can shadow them in surgery. I think what you'll find is that it's a lot more relaxed. I mean, my office can sometimes get crazy, and I can also sometimes get crazy, but for the most part, it's an easier, it's a nice flow. And then also follow us on social media, I guess, so you can see there's a lot of podiatrists and the schools that post a lot about surgeries and their day-to-day, and there's a lot of famous social media people. So that's a good way to learn, to see if it's something that you would also be interested in. If anyone's in the North Jersey area and wants to come shadow me, and I'm sure anyone here would be happy to have you shadow them, we have people that come all the time. So more than happy to do that.
Dr. Favetti?
I would definitely say exactly what Heidi said and come shadow. It's funny that Heidi brought up the fact that it is relaxed. So I have shadows in my office pretty frequently, and I love having them just because it's a good opportunity to teach and kind of be explanatory and stay on your A game as always. But I think also the first thing that usually they say is like, I did not expect this to be like fun and entertaining, and most days are. I mean, it's never a dull day. And I think by spending some time, and again, more than one day, very similar to what Dr. Godoy said, just to get a feel of things, I think that's really, really the best way. Some days are more stressful than others, some days are more lighthearted than others, but that's with any profession. And I think you really need to see it firsthand. I wouldn't go by what someone tells you. It's always good to know kind of with your own experience and use your own judgment. I'm not as active on social media, but I think that's also a great way to do it. There's a ton of accounts now that kind of showcase student life as well as residency life. There's just, you know, there's a lot of resources out there, but nothing can really substitute for your own perspective and firsthand experience. So I think that's really the key to it.
Any advice about like how to approach one's studies once they start medical school? And, you know, how they can balance not just their studies. I mean, do you recommend that students get involved? Do you think it's just about academics?
I will say, I'll take it. So the way I've counseled all my mentees is don't give up what you're passionate about, use it as a carrot. So I had a kid in my chair and he's like, oh, I sold my guitar. It was a Taylor, it was a beautiful acoustic guitar. You showed me a picture. Why'd you sell your guitar? Well, I didn't think I was gonna have time to do it. I said, go get it back from whoever you sold it to. If you have to pay double, like that's your passion. So you always want to have a goal that you're working towards. Okay, I'm going to get my A&P stuff done. I'm going to do my anatomy stuff so that I can play guitar on Sunday, or I could go to a concert, or I could go to a movie. I think if you keep it as a goal-directed thing, then it's not going to be as overwhelming. The other thing, if you have a partner, if you have a boyfriend, a girlfriend, a spouse, invite them to your busiest day in medical school, have them shadow you so that they understand when you're home and you're tired, that they understand your life a little bit more. And then it's a little bit of a team effort, because it's hard to be in a relationship and be in school and give it your all. If they understand what you're going through and where you're at, then I think that partnership is really going to be a good one. And then again, you build in your time, that little time you have, so that you have things to look forward to. So you get your work done so that you can do X, Y, and Z.
Dr. Patel, do you have anything to add?
No, I agree. I mean, I think every part of your career, every part of your journey into medicine is going to be a building block. It's sort of the foundation that you're laying in order to be able to continue high level, high functioning work as you get into private practice or a hospital setting or whatever. If that means that, when you're a student spending 5 hours studying for a test or whatever it may be, putting a time in to manage your time, not only, but also to learn the topic at hand, that's only going to set you up for the future when you are trying to complete, all the notes of all the patients you saw, trying to do, if you're training residents, you're teaching residents, you're talking about procedures, you'll find yourself drawing from some of the things you learned at NYCPM or any other school as sort of the foundation of where this all starts from. So yeah, I think there is definitely quite important to be paying attention while you're in school, for sure.
But also important to be involved. I know everyone here, all our panelists, were very active students in addition to their studies. We have a question about research opportunities during podiatric medical school, research regarding gait, sports medicine, or etc. Yes, there are research opportunities, but I'm not sure this panel is the best. I mean, were you guys involved in research when you were in school? And I know, sorry, not to age you guys, but it's been a while.
I did a couple things. I didn't focus as much on that, but I will say this: if you have an interest, especially at NYCPM, you'll find an attending, and they'll work with you. Come up with the idea, you do the work, they'll get it done. So if you want to do it just like residency, we had to do research every year. But some people publish more than others. If that's your passion, if that's your interest, then sky's the limit. Come up with an idea, make it work.
Thank you so much.
That question is for the younger folks. I mean, we had Palm Pilots when we went to NYCPM.
There's a surgery club at the New York College, and you have to do research. So I was involved in the surgery club, and if you want to be on the board of the surgery club, you have to do research every year. And then if you submit a poster to the conference, and then you get accepted, and then you get paid to go to. I mean, you don't get paid, but they pay for you to go to the conference. So it's all fun things that you can do as a student, which is which then when you're a resident, you could, when you're doing research, it's the same thing. So you get a little like sneak peek into what residents are doing and what everyone else is doing. So that would be my recommendation if you're interested in research, to join the surgery club.
And actually at ACFAS, the American College of Podiatry, ACFAS, foot ankle surgery, we came in first place, NYCPM, so we're really
Oh,
proud of that. But also in regards to research, it's part of our curriculum. By the end of your third year, all students have to present a research poster now. It's a requirement to move on to your fourth year. That said, a student is asking if Dr. Monaco can answer questions. So post the panel, what we will do with our panelists' permission is to provide email contacts. Will that be okay?